still remember the first time you invited me here to have a conversation. It was just so exciting, and at the same time I just thought, you know, this is a good experience. You know, I'm not going to hear from them again at all. But it was just so nice to to see you guys and to see to make eye contact with these amazing people that we're doing this.
Pre-screening, we did all the photographs. We did just 2 X-rays, one on each side, just to make sure there wasn't any decay anywhere.
Yes.
But now we're going to take an X-ray of every tooth.
Okay. Really? That's
Really?
Cool.
In our office, we have digital X-rays, which might not mean anything to you, but instead of a film that I need to go and develop and wait a few minutes to make sure that we have everything that we need, it actually plugs into the USB and then comes up on the screen as soon as I take it. It's also 90% less radiation than a typical film X-ray, so doing an X-ray of every tooth in your head like we're doing today is really just one film X-ray. Before I clean your teeth, I need to do an assessment of your gum tissues. So what that is I have a little measuring tool and it has little measurements on it that are 1 millimeter each. So I'm looking for numbers from 1 to 3 millimeters because that's what we consider healthy gum tissue, because that's where toothbrush and floss can reach easily. Anything more than that, like a 4, usually just means that the gum is very puffy, so it looks like my instrument is going further beneath the gums. But anything like a 5 or a 6 or a 7 millimeter pocket means that there's bone loss happening around the tooth. I'm also looking for no bleeding gum tissues, because healthy gum tissue should not bleed. Just like when you wash your hair, your head doesn't bleed. It should be the same with the gum tissue, that when we poke it and clean it, it should also not bleed. 2, 2, 3. We've done our measurements. I'm going to go ahead and clean your teeth. I use an instrument that sprays lots of water and it vibrates back and forth in a very slow motion. You can't see it, but you can actually hear it once it touches the tooth. But I find this way of cleaning teeth much more effective than the typical hand scaling. I kind of equate it to trying to do your dishes without using water. The water goes underneath the gum tissues as well as my instrument, and it disrupts all the bacteria and all the calculus, like that hard plaque that I have to remove that you can't remove at home. And then the water flushes everything out. So this not only removes the stuff that I can see and feel, but it also removes the bacteria, which is called biofilm. With the piezo, which is the instrument that I use to clean the teeth, I use nice hot water, so it's really comfortable on the gum tissues also.